So our students are required to do 10 rotations on their 4th year of school. We have 6 required rotations and 4 elective rotations. Sure, interprofessional education is learning with other professionals, so that can be in the classroom or it can be at a site, at a hospital, at a community pharmacy, but it's also learning how to work with those professionals. So how do you communicate with a doctor? How is that different than how you communicate with a physical therapist? So really learning those kind of things, and then what makes them special. And that's really important. As you go out and start taking care of patients, you need to be able to communicate with each other and be able to talk about a patient to really provide them the best quality care that you can. And interprofessional education is the first stepping stone into you having an interprofessional team that's really collaborative and looking out for best patient care. So we've actually discovered that most sites offer interprofessional education. It may not be actually in a class or something where they actually learn with another student, but there's not a single place in pharmacy where you don't work with somebody that's not a pharmacist. So there may be some places that you do that more or less, and we can go out and check those out and see what's going on and talk to the students. They actually give us a really good idea of what's happening at sites. And so we ask in our evaluations, what other types of professionals did you work with at this location? And never has anybody said, I didn't work with anybody else. There's always other things going on. You never practice in a silo. I think that that's going to become less of a challenge in the next 5 years. We're really starting to instill in our graduates that part of being a pharmacist is educating future pharmacists. And so as you see graduates come out, they're really excited about being a preceptor and working with students. And so I really see that as becoming less of a challenge because they're really wanting to be involved in that process. So we have a couple different ways that students can research different sites. The first and our one that we're really excited about is we have a preceptor showcase where preceptors come in, they actually set up a little booth. It's almost like an exhibit hall, and they talk about their rotation site. So this is what you'll do here. These are the kind of people that you'll meet. This is the kind of expectations we'll have at the site. So that's one way that our students can really go and engage with the actual preceptors and talk to them about what's going to happen there, what's the expectation. So in ARC's Preceptor, we use the Research Center, and we keep those profiles really up to date and try to put everything we can about a preceptor or a rotation site in that profile. The students can really get a feel for what they would be doing at that site and try to make a good decision about if that would help them meet their educational goals or not. Then they go ahead and they rank what their first choice, second choice, and so forth for the different rotation types are after working with their faculty mentor to really talk about their career goals. Once that happens, then we put them into the spin process, and it's really kind of a luck of the draw. If you're the very first person, you'll get your first choice, and so on and so on. We've done research that over 95% of our students get one of their first 10 choices in our IPPEs. Our APPs, we've only done 2 years, so we don't have that research yet, but students generally get things that they rank very highly through the spin process. Then we go through that, make sure the students meet all their needs, that we're really looking at their rotation schedule, making sure it makes sense for them, and then we release it to the students and they review it. We track so many things with our students. So one of the great things that we like about ARC's Preceptor is the ability to really tailor our questions for specific experiences. So we have them track if they do different types of programs that they have to do. So they have to do an educational program while they're at a hospital. We track that. We use the field encounters for that. We can then the preceptors can go in and even rate how they did on that field encounter. We also track their hours that they're at a site. We track what kind of health professionals they interact with. We track different things about our preceptors. So they felt that the preceptor did a good job at this or could be better at this. We track all that. We keep different records of that, and we make sure that we have good quality sites for our students, and we're helping our preceptors as they need help developing. So those are all different things and lots more that we can really use and track and really refine our processes.